Has anyone ever tried to force you to do something sexually that you did not want to do? When you hear the term sexual assault, do you automatically picture this happening to a female by a male perpetrator? Have you ever heard of the term birth control sabotage? These are a few of the concepts that I'll be defining and explaining today as we examine the next abuse behavior, which is actually an abuse category called sexual abuse. I'm going to focus on 3 aspects of sexual abuse which occur within abusive relationships: sexual coercion, sexual assault, and birth control sabotage. This is Truth and Heart Unfiltered with Pam Glenn. I'm a certified nurse midwife, sharing information about relationship abuse, as well as defining each individual abuse behavior one post at a time. And as always, I like to give the alert that the content in these posts do include topics of trauma. If this is triggering for anyone, please turn the video off, and as always, take good care of yourself. So again, today we'll be looking at sexual abuse, which includes sexual coercion, sexual assault, and birth control sabotage. Let's start with sexual coercion. And before I define it, I do want to remind you that abusers may be male, female, may be LGBTQ, as well as gender nonconforming. So the definition of sexual coercion is this: the abuser forces, pressures, manipulates, or threatens their partner to do something sexually they do not want to do. Also with sexual coercion, the abuser may introduce alcohol or drugs into the relationship to make their partner more vulnerable to unwanted sexual activity. So let's focus on one aspect of sexual coercion: the abuser forcing their partner to do something sexually that they do not want to do. This is sexual assault. Now, let's step back for a moment and think about the stereotypes that we might hold in our brains when we hear the term sexual assault. When you hear the term sexual assault, do you automatically picture an attack by a male towards a female? Maybe you picture a female being assaulted in the parking ramp at night, or maybe while walking home from work or walking home from the store. This might be the case. It can happen in these situations, as I'm sure you know. However, sexual assault also occurs within abusive relationships, in which the abuser forces their partner to do something sexually they do not want to do. For example, sexual assault occurs in dating relationships. It occurs in relationships in which couples are living together, or well-established relationships. It occurs in marriages that are abusive. Sexual assault may occur by a male abuser towards their male partner. And again, it can occur in LGBTQ as well as gender non-conforming relationships as well. Now, another aspect of sexual abuse is birth control sabotage. This is where the abuser uses calculated actions that lead to a pregnancy. Birth control sabotage is the active interference with a partner's birth control method in a very clear attempt to promote a pregnancy. So some examples include this. It may be a male abuser who sabotages their female partner's birth control method, just trying to get her pregnant. Or it may be just the opposite scenario. It might be a female using calculated actions that lead to a pregnancy. And why? Why do abusers use birth control sabotage? Again, to obtain and maintain power and control over their partner. What are some examples of birth control sabotage? It might be an abuser who tampers with their partner's birth control pills or other birth control methods by hiding, withholding, or even destroying their birth control. It might be an abuser who keeps their partner from being able to pick up their birth control refill. It may be an abuser who lies about their birth control method. who might say, oh, I'm on the pill or I've been sterilized, so there's no chance of me getting pregnant, when actually that's not true at all. It may be an abuser who breaks or pokes holes in a condom or actually takes the condom off during sex. And it might even be an abuser who removes their partner's vaginal rings, IUD, or even the birth control patch. Now, I had a case long ago. One of my female patients came in because she could no longer feel her IUD string, which is something we instruct them to check to make sure the IUD is still in place. So I did an exam and I did not see the string at all. I sent her for an ultrasound and sure enough, the IUD was missing. It was no longer in her uterus. So she came back to me about a week later and she shared with me that she told her boyfriend about the situation, that her IUD had apparently fallen out. It was missing. It was no longer in her uterus. He then admitted to her that he pulled the IUD out during sex because he wanted her to get pregnant. This is a very clear example of birth control sabotage. Now, another way that sexual abuse can play out in a relationship is when there's an unintended pregnancy. An abuser may try to force their partner to have an abortion, or they may do just the opposite. They may prevent their partner from getting an abortion, which is what they may be desiring to do. It can play out either way. So to summarize, we've discussed 3 major aspects of sexual abuse that can occur within abusive relationships: sexual coercion, sexual assault, and birth control sabotage. Now, on the flip side, in healthy relationships, there's no forcing or pressuring. There's no manipulating or threatening a partner to do something sexually they don't want to do. Instead, partners respect each other, including respecting when each partner is ready to be sexually active with each other. They ask rather than assuming that the other partner wants to become sexually active. There's open and respectful discussions about birth control plans and STI prevention. There are respectful and open discussions about when a couple may want to have a baby, if that's the case, and the decision is made together. And again, if there's an unintended pregnancy, there's open and respectful discussions about whether to continue the pregnancy or not. Thank you so much for listening. This is another very intense topic, but a very important aspect of abuse that also needs to be addressed and explained. And although this is an extra sensitive topic, if you're so moved, feel free to add your thoughts, your questions, your perceptions in the comment section of this post. And if you do, as I always say, please be sure not to use any names or identifiers. Now, I encourage you to subscribe to this YouTube channel and pass this information along to others, because you just never know how this information might help someone else. And if you're in an abusive situation, please check out the written part of my post, which includes the hotline numbers and an advocate that is available to you 24/7. And if you're in any kind of danger, please call 911 immediately. So take care and stay safe. I look forward to seeing you at my next post, which will focus on the abuse behavior called manipulation and desperation.